I'm David Silbert. I am an ophthalmologist who specializes in eyelid surgery or oculoplastics. We're going to talk a little bit about tearing today, and we're going to talk about a procedure called a dacryocystorhinostomy, and also just talk about putting stents in the office for lesser forms of tearing. Two things that you have to think about with tearing are overproduction of tears and underdrainage of tears. There are two tear drains, one in the lower eyelid, one in the upper eyelid, all the way towards the nose. And they drain into the nasolacrimal sac right here, and then they drain down into the nose. If the nasolacrimal system is closed, you're going to tear all the time. And if it's fully closed, also you're going to develop infections. So that's called a dacryocystorhinostomy, where you can develop like a nodule right here, and you can actually develop a cellulitis, like a facial cellulitis, if it's not treated. So that's the most severe form of tear drainage obstruction. But there are other forms too, where there are partial tear drain obstructions. In those cases, it's just the tear drainage system itself is tight. So what can be done for those situations is procedures can be done in the office even to open up the tear drain and place a stent in the tear drainage system. The stent typically stays in place for about 3 months, and then we remove the stent. And after that, the whole system is larger and the tears flow more naturally. Other things that can cause tearing are malposition of the eyelid. So basically, the eyelid is not sitting right against the eye. It's kind of gapping out from the eye. And what we do for that is we tighten the eyelid. So that's called an ectropion repair, where I make an incision right here, I remove a small amount of tissue from here, and then I reattach the eyelid to tighten the eyelid. Sometimes what we do is we do that, and we also open up the tear drain and put a stent in. So we're doing as much as we can to improve the tearing. A DCR is called a dacryocystorhinostomy, and what it is it's making an opening from the tear sac, which is right here, into the nose. So there's direct drainage from the tear sac into the nose. And again, what happens is each eyelid has little tear drains that direct the fluid into the nasolacrimal sac and the duct. So if that's closed, we have to do what's called a DCR, so dacryocystorhinostomy. That's making a new opening into the nose. So patients who have a complete nasolacrimal duct obstruction, not only do they have tearing, but they're at high risk of having an infection, which is called a dacryocystorhinitis, which can cause an acute nodule right there and painful pain in that area. It can also cause a cellulitis, and sometimes patients even get admitted to the hospital. So what happens is, if you've got a complete nasolacrimal duct obstruction, it's actually important to get a DCR so you don't end up with one of these serious infections. There are a couple different ways to do dacryocystorhinostomies or DCRs. And the classic way is an external DCR, meaning that you make a skin incision, and you make an incision right here underneath the eyelid and into the corner. And then you open up the tear sac from the outside, and you make the opening through the thin bone into the nose from the outside. To me, that's kind of an older procedure. And what I like to do is what's called an endoscopic DCR. So that's kind of using the same instrumentation that the ear, nose, and throat doctors use. And we go inside the nose, we have a big monitor, and we view what we're doing on the monitor. And I do all the work from inside the nose and just from the tear drains above. So there's no external incision, and there's much less swelling after the procedure. There's no scar externally, and patients heal much quicker. And I've been doing these procedures for over 20 years, and I've published on these procedures, and I've got a good success rate. So people actually come out of the area to see me because there aren't a lot of people in this area doing endoscopic DCRs. There are more people who are doing the external DCRs.